the Department of Public Health is prior to the pandemic was a pretty well-kept secret. We took care of a lot of people, and a lot of people got good services from the county. And after the pandemic, we were defined like public health departments across the country and making very difficult decisions to try and balance lives and livelihoods. I think we're stronger for it, and our community is really in a good place.
The role of St. Louis County Public Health Department, it is to protect the community, to make sure that keeping communities healthy, that we're keeping them safe, and we inform the community as well. I think it's important for the health department to kind of be that connector to community partners, to hospital systems. We are truly here to serve St. Louis community and to make sure that we are promoting the health and well-being of every individual in St. Louis County and making sure that we lead with an equitable approach.
A key role for public health is always to be preparing for the next thing, right? Whether it's a pandemic or the impact of trends that we're seeing in different chronic diseases or what substances are starting to show up in the community. Our threats aren't always a pandemic or an infectious disease, but there are many things that can impact our community.
We offer a wide range of services I think people may not be aware of. When we think about strays that roam our neighborhoods, that's the responsibility of the health department's animal control officers are out there making sure that our kids are safe while they walk to school. And most importantly, we do provide direct clinical services. I think some people don't look at the health department as an entity that you can come and see a physician for hypertension management, diabetes. Your kids can come and get their vaccinations. I hope that we are able to continue to do that work, and not only that, but expand it by partnering with the community and listening to what the community needs.
My duties at the Department of Public Health include lead risk assessor for the Healthy Homes program. So that's going out and responding to inquiries that we get from concerned parents, physicians, and from the state if the results are high enough to go out and perform lead risk assessments in people's residences. It's important to try to create that rapport and that almost friendship with people so that they can feel comfortable with us coming into the home and trying to help you find a way to live safely with these things. The big ticket item is our HUD grant that we were just awarded, the Healthy Homes Production Grant. It's the most rewarding task that I have because the people that are applying to get into the program, they're going to get that help.
There's been times when I've given out information to get somebody an air conditioner. I've gave out resources for appliances. There was a fire that happened in an apartment, and somehow somebody gave them my number and they lost everything, clothes and everything. And I was there to help them. If that person that gave out my number didn't trust me, they wouldn't have done that.
The medical examiner's role in St. Louis County is to investigate sudden, suspicious, and unnatural deaths. Key services that the medical examiner's office provides starts with autopsy examination, then second, death investigation. We also deal with toxicology, and we also provide anthropology services as well.
The people that I work with here at the Department of Public Health, I would say, are committed and selfless, especially working through the pandemic. People put everything aside that they were doing to focus specifically on how we could improve the lives of St. Louis County residents and make sure that they had all the information and everything that they needed to feel safe and secure throughout the pandemic.
I decided to go into public health because I am passionate about service to the community. I've always had a heart of service. And with public health specifically, I've been able to look at social determinants of health and how that relates to substance use disorder. And I want to be able to dispel inequities and address disparity and advocate for people who are marginalized. And that is why I decided to come into public health.
The Department of Public Health is developing strategic partnerships. We have over 40 partners who are involved in our community health improvement plan. So we have action teams that are focused on some of the top priorities that improve and protect the health of St. Louis County residents.
I want to thank all of the staff and the employees for all of their hard work and their dedication. All of our community partners for always reaching out to the health department, wanting to collaborate or share their thoughts and their ideas. Thank you to everyone, but most importantly, the community that we serve. So thank you.